Ladies and gentlemen, may I request you to join me in welcoming our chief guest, Shri Bandaru Dattatraya, the Honourable Governor of Haryana.
And affordable nutrition means providing a healthy diet. And let me tell you, friends, that healthy diet doesn't mean only providing nutrients. It's a lot more. So it's in terms of quantity, yes, adequate nutrients, sufficient macro and micronutrients, but also to limit overconsumption. Overconsumption, particularly of nutrient-poor foods, which are high in calories, fat, and trans fats, and sugars and salt. Commonly called the HFSS, high fat, sugar, salt foods. The healthy diet should also be diverse, and we have been hearing for the last 2 days that the diet diversity in our country is very, very poor. Fruit and vegetable intake, milk intake is very low. So if we look at this data, globally over 3 billion population could not afford a healthy diet in 2020. Most of these countries are in Africa. In Asia, India is about 70.5% of the population was unable to afford a healthy diet in 2020. We need to really rethink and promote local and seasonal fruits and vegetables. We need to look at media campaigns, school-based interventions, public-private partnerships to improve marketing and advertising for nutritious foods. For the poor, of course, it's the inadequate resources along with information. So then we talk of national policies like employment, like value chain opportunities, improving access to nutritious food, either through the PDS or through the MDM scheme, and some transfer programs, things like community gardens, kitchen gardens, which the Poshan Abhiyan is emphasizing on. And of course, food fortification is a cost-effective, sustainable intervention that will help to address micronutrient deficiencies.
Fortification of staples like wheat flour, rice, oil, milk, and salt provide micronutrients to bridge the gap between the need and the consumption. And they reduce the dietary deficiencies across all population groups because everyone, irrespective of their nutritional status, irrespective of their economic status, consumes these staples. The strategic advantages are that it is consumed by all. It is a proven, simple, low-cost technology. It is preventive, population-wide approach through which fortified foods can be made available through the systems like PDS, ICDS, MDM. Since staple foods are centrally processed, the possibility of or the risk of excessive intake is minimized. So fortification is very safe. But we need partnerships to translate science into action because it is important to catalyze collective actions to improve nutrition in India. We need effective and sustainable partnerships, and all stakeholders need to collaborate. For example, scientific community to identify problem, research, provide effective solutions, public sector to provide legislation, mandate, enforce, and regulate, because that's extremely important. Private sector, as Seema was saying, produce, process, advertise, and market nutritious food products and fortified staples. And social sector undertake policy advocacy, monitoring and evaluation, capacity building, and social and communication, and consumers to make informed choices to get the best.
What all of us at this conference would agree upon is that nutrition needs much greater priority and that the focus also needs to be on dietary diversity. We would now invite the Honourable Governor to make his remarks.
मुझे बेहद खुशी है हमारे हरियाणा प्रदेश में स्थिति NGO सुकार्य अपनी अध्यक्ष श्रीमती मीरा सतपथी के नेतृत्व में गांवों और मलिन बस्ती में समर्पण के साथ काम करने के 25 साल पूरे होने के जश्न मना रहे हैं। इस जन कल्याणकारी नेक कार्य की सफलता के लिए मैं संस्था को आर्थिक मुबारकबाद देता हूं और बधाई भी करता हूं। और मुझे बेहद खुशी है कि आज के इस सम्मेलन में यूनाइटेड स्टेट्स ऑफ अमेरिका और नीदरलैंड, मलेशिया, नेपाल, बांग्लादेश और साथ ही साथ अपने इंडियन एक्सपर्ट्स, मैं सार्वजनिक मातृ स्वास्थ्य एवं पोषण के अंतर्राष्ट्रीय सम्मेलन में आप सबके बीच उपस्थित होकर बहुत ही गौरवान्वित महसूस कर रहा हूँ। पिछले कई वर्षों से सुकार्य 760 से अधिक गाँवों और 190 झुग्गी बस्तियों में 70 लाख से अधिक महिलाओं और बच्चों तक अपनी सेवाएं पहुंचाकर लोगों की सहायता कर चुकी है। ये सभी कामना करते हैं कि सुकार्य भविष्य में भी इसी प्रकार से अपने महान लक्ष्य के सफलता हासिल करने के लिए आगे बढ़ते रहेंगे। आई एम वेरी हैप्पी दैट all the speakers are most persons who are sitting in the dais are mostly women. I welcome them. Simple habits, simple food will make you always healthy. I think Ayushman Bharat is the world's largest health insurance scheme in the world. We have set up 1,50,000 health wellness centers to provide maternal and child health care. सबसे ज़्यादा महत्व की बात है educate the people, educate the women, educate the children, awareness among the people. ये दो विषयों को ध्यान में रखिए। मुझे बहुत खुशी है आज जो सुकारिया मुझे यहाँ बुलाकर हमारे मैडम शतपति जी को और उनके टीम को मैं धन्यवाद देते हुए समाप्त करता हूँ। जय हिंद।
If we try to connect the dots, I think it's safe to say that we are currently facing a new era of public health practice, where challenges and drivers coexist but also interact. And that has given rise to a lot of new challenges. So when looking at nutrition and diet, there is, and again, the previous speakers have expanded upon how the rise in energy-rich and calorie-dense foods is creating ripples of challenges across society, which also leads to the coexistence of malnutrition and overweight. But at the broader field of public health, there is also that double burden of disease, these emerging infectious diseases. So I think it's time to understand these issues in their context, and I think it's time to familiarize ourselves with the fact that we are living in a new era, that old thinking patterns will not solve the current problems, and that hence we need some new solutions. It's also important to recognize that we operate within the planetary boundaries. Our planet can only take so much, and we must operate in the safe zone where we can thrive and look towards the future without compromising it. However, it is of fundamental importance to realize that investing in public health and nutrition is investing in the future. In the fields of public health and nutrition, we are facing old habits that are refusing to die. We are facing new challenges, but we are also facing new opportunities for solutions. So I would suggest that we start slowly thinking in systems, see interconnections, build bridges, harness the feedback loops, think outside the box, and train new skills. Because we need new solutions for the new challenges.
Do we not all agree that food safety is vitally linked to our health, our nutritional status, in fact, to food security itself? Because if food is not safe, you can't even consider it as food for yourself. A report by WHO says that there are about 31 foodborne agents, and these include bacteria, viruses, parasites, but also toxins and chemicals, which are increasing the foodborne disease burden in the world. And this burden is disproportionately being borne by children who are under the age of 5 years. The highest burden is being felt in the low and middle income countries. The annual cost of treating these foodborne diseases is estimated at $15 billion. This is like a vicious cycle where foodborne infections cause loss of appetite and symptoms like nausea, vomiting, and diarrhea, leading to decreased intake of essential nutrients, increasing malnutrition. We all know that malnourished individuals also have a lowered immunity. These people are then susceptible to secondary infections and further foodborne diseases. Some have called this a leaky bucket situation. You put in the resources, you put in nutrition interventions into the bucket, and nothing will stay because it is a leaky bucket. There's a very interesting study by Wilkins et al. And this is a systematic review of about 71 studies where they have looked at environmental risk factors which are associated with child stunting. And they have found that the factors which are strongly associated with an increased risk of childhood stunting are foodborne mycotoxins, which are fungal toxins, a lack of adequate sanitation, dirt floors in the home, that is not pakka floors, poor quality cooking fuels, and inadequate local waste disposal. And they concluded saying, health promotion activities may be more effective if they consider environmental factors alongside the nutritional interventions.
Thank you.
Ironically, when we see the other side of the spectrum, the women with the minimum diversity is lowest amongst the world for us. Similarly, when we talk about the minimum diet diversity of under 5s, it is not only low but it is further declining. So this is an issue of concern why we need to work in this area in a more intensified manner. So when we talk about a picture as a whole, we are saying that we have a strong improvement in agricultural practices. We are saying that we have a strong improvement in nutritional health coverage across all the continuum of care. So why is this problem? So the problem is the missing middle of the food system. Something is there in the middle which is missing, and one needs to put all the efforts in that middle part so that we can form a continuum of care across all the interventions in the food system. So how can we find and make food system more nutritious? This is a slide, I think, which connects all the dots of our discussions for past 2 days. This is a food system in whole. So food system overall talks about major 4 components, which are namely food supply chains, food environment, individual factors, and consumer behavior. These all 4 connects to influence the diet of a person. So if we are talking about that we need to reach the last mile and improve that person's diet, we need to work on each and every component of the food system. So how to get here to nutrition. So I have broadly considered these 5 major areas where we can discuss in depth to see that how food system can be made more nutritious. First of all is like how the government should prioritize the nutrition. We have been seeing that through the classic example, which is now 2023 is celebrated as Year of Millets and the highest push from the Prime Minister of India to promote the production and consumption of millets to the last mile of our country is the biggest example, which shows that how the topmost priority for government now is to improve the nutrition for people around it. Along with that, there is a launch of 17 biofortified varieties of 8 crops by Honourable Prime Minister on 75th anniversary of FAO, which again gives us that government wants to work with the smallholder farmers to promote not only their income but at the same time provide the nutritious food to the people who need it.
I think it's also quite amazing that despite 2 days of discussion on these issues, we still managed to get some new ideas in this last session as well. And there were a whole range of issues that were discussed, right from dietary diversity, access, affordability, systems, health system, climate system, gender, and new ideas in all of these. I won't take too much time, but just hope my only concluding remark is that we move towards hopefully a more sustainable and equitable food system that ensures healthy diets for all, And also the learning which keeps coming back again is that while we work in our silos or our specific areas, obviously all of us can't do everything. Hopefully conferences like this teach us to keep these other issues in mind and what the impact of what we are doing is on everything else and how everything else affects the area we are working on. So before concluding, I request my co-chair, Dr. Monica Ruiz, to make her remarks and also conclude the session. Thank you.
Thank you so much. It's been such a pleasure to be part of this panel with such dynamic speakers. I just want to highlight a couple of the themes that came across through all the different discussions. One thing that the kind of overarching theme is that we've made much progress, but many challenges remain, and also many opportunities remain in front of us. We have the challenge of affordable nutrition, which is not only about economic affordability, but also dietary diversity and safety to promote healthy nutrition. That is a challenge that still faces us and an opportunity that we need to embrace in order to improve nutrition overall. We have the additional challenge of food and nutrition security being of great concern. Despite a great deal of wealth in many of our countries, there's still a great deal of challenge for people to be able to have nutritional security. And the data available on this draws attention to the social determinants of health, such as poverty, and reminds us that the health consequences of poor nutrition affect both rich and poor. So it's not just about poverty, but it's about how it affects us all. The third theme is the continued need for greater synergy, integration, collaboration across all sectors to promote nutrition. This is everyone's job, whether it's governmental, private sector, all parties working together globally and domestically, depending on how you're determining domestic, whether it's India or whether it's the US or whether it's the Netherlands or wherever. We all have to work together to address this. We have the additional challenge of food safety, not only the typical microbial hazards, but also the human-created hazards like climate change, urbanization, and other environmental factors that address that impact food as being not safe to eat and therefore unable to provide us with any sorts of nutrition. So in the end, when we come down to it, we come to the realization that investing in public health, as Dr. Pierre said, investing in public health and nutrition is investing in the future. And this investment needs to come from all levels with improved coordination and with the goal of benefiting humankind overall. I hope that wrapped it all up in a nice little bow for us. And I think this hopefully is a theme that we can carry forward into our furthering discussions as well. Thank you very much to all our presenters.
I stand here to announce that the conference is closed. It was glorious and phenomenal 2 days that it is actually impossible to fathom the amount of learning, the amount of knowledge sharing, the amount of fun moments and everything, and I believe the food was good as well. So, so I think I have to announce this. So we are done for today, and probably we will be meeting again in another couple of years, but I'm not sure about the date as well. So it's concluded. Thank you.